please ask him, stay a while to interact and engage, because this is your time, all right? And he is here for you and all of us to help our community be more healthy. Please welcome Dr. Snyder.
All right. Hi, everybody. Thank you, thank you, thank you. I'm a scientist, not a IT tech, and so we're just trying to iron out a few kinks here as we get started. But I'm going to ask you a question as an audience. Do you prefer this view or this view? Okay. We'll leave it there then. I think that's bigger and easier to see. Yeah. Okay, so wanted to kind of address, what's going on in our world today. We have COVID and it just has turned our world upside down. Typically, I come up and I do these seminars. I'm talking about diabetes and high blood pressure and heart disease and all these things. And so I wanted to kind of integrate these ideas into what's going on in our world and how can we have health and any kind of healing in our world today with what's going on. And so we think about the emphasis on COVID today, and almost everybody's thinking about health anymore. So I would say the most common topic today when I am visiting with my patients is all about COVID. And everything is COVID. COVID this, COVID that, COVID vaccines, COVID Paxlovid, COVID positive, and right now we're in the middle of a giant COVID expansion again. It's just growing like crazy, and so everything I do at work anymore is addressing a COVID positive patient, almost everything. And so we're just being inundated this. So everybody asks about it, and most people are, I would say most people are pretty afraid of it. And so there's a very divided public out there about, vaccinations, no vaccinations, masks, no masks. And so there's a segment of people that seem to not care too much and others that really care a lot about it. And so, but everybody's thinking about it because it's affecting their jobs, their livelihood, and everything. And so I wanted to see what we could do as a person, as a patient, to stay healthy in this time. So that's what I want to address today. So I have to admit, I'm getting pretty sick of talking about COVID, but I'm hoping that we can learn some things from this today. So 106 years ago, the biggest concerns in the world were something not really that different. So we look at the pandemic, the Great Flu Pandemic of 1916. Over 1 million people died from influenza, and up until 2 years ago, the biggest health concern we had nothing to do with infectious disease. It had everything to do with heart attacks and strokes and diabetes and overweight and all of those kinds of things, smoking cessation. But something really changed, and so we're thinking about, as we look at this graph here, what it's illustrating is 100 years ago, infectious disease was a really big deal. 1 million people died from the flu. And COVID's a lot worse than the flu. And as we've seen, we actually have lost a lot more people in the world. But as time progresses, this is the spike for the flu right here. As time progresses, infectious disease becomes less and less and less of a problem until we get out to our modern day. And really, it is a minimal cause of ill health. There's almost nothing infectious disease until COVID came along. And historically, if we look at this, what this graph is telling us is we're looking at infectious disease is the green line. We just saw that chart, how it's gone down, 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 down. And this is all about lifestyle disease. So we've seen in the same time that infectious disease is going down, lifestyle disease has been coming up. Why is that? Well, people are living longer. 100 years ago, when the average lifespan was closer to 50 than 80, we didn't live long enough to have diabetes type 2, to have a stroke and a heart attack and things like that. So as we live longer and the infectious diseases are going away, we're seeing more of these kind of lifestyle diseases. And so that's all this is at. This is called an epidemiologic transition. So up until early 2020, chronic disease was far and away the greatest healthcare burden in the world, especially in the Western nations. There are still some third world countries out there that are dealing with infectious agents and problems that we typically don't see because of our high level of sanitation and hygiene in developed countries. So nearly all Americans over age 30 are considered victims of chronic disease. Almost all. Do you know why that is? Well, almost all Americans have a weight problem. And a classification in our disease classification, Western medicine, being overweight is considered a disease. And so almost everybody over age 30 in the United States is overweight. And so almost everybody has a chronic disease problem. So that's really been my emphasis as a physician, trying to help people with their chronic disease. So there's some things about non-communicable diseases, risk factors. They have modifiable behavioral risks. So for example, if you smoke, you can quit, right? If you're an alcoholic, you can stop. And so there are ways that we can modify your risk of these lifestyle diseases. So 4.1 million annual deaths have been attributed to excess salt and sodium intake, just because our food is so preserved. And more than 3.3 million annual deaths are attributed to alcohol use, and these lead to these non-communicable diseases, and this includes cancer. So this has been my whole area of expertise, almost my whole career. I've never had to deal with infectious disease. This is completely new to us. And so 1.6 million deaths annually attributed to insufficient physical activity. So these are modifiable things. These are things we can do something about. We can stop eating so much salt. We can exercise regularly. We can stop smoking. We can stop drinking. And then there are the metabolic risk factors. So these include things like blood pressure, our weight, hyperglycemia, that's elevated glucose, elevated cholesterol and fats in our diet. These are all modifiable as well. And I've spent the last couple decades doing these seminars teaching people how to modify their risk factors so that they can be healthy in this scenario of non-communicable chronic lifestyle diseases. So with that, something has changed. Oh, looking at the costs of all of this, this is incredible. In 2016, the total cost of U.S. for direct health care treatment for chronic disease conditions totaled $1.1 trillion. That's with a T, equivalent to nearly 6% of this nation's GDP. The most expensive conditions in terms of direct health care costs: obesity, diabetes, Alzheimer's, which has really come up, and osteoarthritis, very, very common. The most common chronic health conditions in the United States are hypertension, which is high blood pressure, problems with your cholesterol, and joint pain, aches and pains, so degenerative type of arthritis. Obesity is by far the greatest risk factor contributing to the burden of chronic diseases in the U.S., and this was just published in 2020. So this is fairly recent information. And just looking at the leading causes of death worldwide, we would see ischemic heart disease, stroke, lower respiratory infections. Keep that in mind because that's actually where COVID starts to come in. Chronic pulmonary disease, cancers, diabetes, Alzheimer's, diarrheal diseases, tuberculosis, road injuries, those kinds of things. So a lot of things that are very chronic that we have to deal with because it's just killing so many people. So this is listed by the World Health Organization from 2015. Then something changed. Along comes COVID-19, and it happens. A new world pandemic. And I just updated these numbers just a couple days ago. Over 83.1 million cases in the United States. Over 1 million deaths in the United States, 6.28 million worldwide. So that's 6 times more than the 1916 flu pandemic. So this thing is enormous, and it's deadly and dangerous. This is not quite the caseload. In 1916, the influenza pandemic had 500 million cases, but only 50 million deaths. And so 6.8, oh, I guess we're still trying to catch up to it, sorry. And the deaths worldwide, and 600, that's what it was, 675 deaths US. So we've surpassed in the United States the amount of deaths that happened with the influenza pandemic. So we're well beyond that. World is catching up. So with an increased death rate of 17.7% in 2020 and increased by another 0.7%. So what happened, we get this big spike in deaths of infectious disease, and that continues to climb. So we're seeing it's a slower increase, but still climbing. So this is really where the two ideas start to come together. When we look at non-communicable diseases and infectious disease, there's risks associated with both of them. When we look at the risks with non-communicable diseases, we looked at that already: obesity, smoking, drinking, too much salt in the diet. And looking at that, well, look at the risk factors that are associated with death with COVID. Obesity turns out to be one of the leading risk factors for dying from COVID. Diabetes, COPD, asthma, smoking, heart disease, hypertension, cancer, and COVID, of course, is now third on the list in what's killing people. So right here where those lower respiratory infections are, COVID's making up about 6% of the deaths in the United States. So it's climbing as the #1 killer in the United States right now and in the world. So again, when we look at chronic disease, these are the non-infectious, they compare very much to the same risk factors for infectious disease. So we see the same risk factors that you have for diabetes, for heart disease, stroke, and all of those are the same risk factors you have of dying from COVID-19. So the idea here is with chronic disease, I'm trying to teach people how to reverse their chronic disease. And we have great success. We use the New Start program. I have treated probably about 300 patients so far with this program, and every single one of them gets better. And so I can't, if you come into my office and you see me as a Western physician and you want me to help you control your diabetes, I'm going to write all the medications for you and do all that. I'm board certified. I can do all of that for you, but it's not going to reverse your diabetes. I'm talking about reversing your disease. And we can do that through our program, and that's what we teach. Turns out some of the things that we're doing here is going to protect us from COVID-19. So there is a parallel here that we can learn from about how to boost our immune system to make us healthy as we can be so that we have the greatest chance of surviving COVID-19. So by treating these diseases, it leads to improved, healthier immune systems, lower risks of deaths from all causes, including infection from COVID-19. So that's what we're going to be exploring tonight. And we're going to, as the week develops, we're going to be looking at how we can improve and boost our immune system. It's one of the most important things we can do. Modifying the risk factors that predispose us to severe disease or even death from COVID. And we're going to show how that modified lifestyle will help you if you have problems with diabetes, with your weight, with your blood pressure. We're going to help you with that as well this week. So we're going to be looking at both chronic and infectious disease. So hospitalization rates, including that of the most likely folks to end up in the ICU, are immune compromised. They have these problems: obesity, hypertension, chronic heart, lung disease, and diabetes. So it goes without saying that if we can modify that and take those problems away, we're going to make you healthier and less susceptible to dying from COVID-19. Does that make sense to you? Yes. Yeah. So longevity, based on medical science versus good health. So we're going to take a look here at the concept of longevity, and longevity basically just means how long people are living. And do you know that this last year was the first time in the history of the United States that the life expectancy dropped? In my lifetime. It's been going up since I was an infant. Last year it dropped. It wasn't a lot. I would suggest to you the extension lifespan to 77, 78 years. It dropped about a year. So from 78 to 77, from 77 to 76. And this change in lifestyle that's brought us to the place where we actually have this kind of lifestyle. Remember, early on in the early 1900s, the lifespans were much shorter. Infectious disease was the leading cause of death. And by taking care of infectious disease, developing vaccines to polio and smallpox and some of these other things, we have extended people's lives. And now in doing so, we're seeing all this chronic disease that's coming out because people are living long enough to develop that. So it's clear that COVID kills those who are immune compromised. Could it be that a wiser approach to longevity may involve improved immune systems instead of medications? So we extend people's life with statins, with medicines for your blood pressure, medicines for your diabetes. But what quality of life does that translate into? The average person that's living longer, the quality of life isn't there. They're living longer, but they're not necessarily happy, healthy, and active. But what I've seen in our program with New Start, people that live into their 80s, their 90s, and even centurions now are out mowing their lawns and living happy, healthy lives. One of my professors at Loma Linda, he just died recently, but on his 105th birthday was out mowing his yard. Okay? He lives in a blue zone. Are you familiar with blue zones? Do you know what those are? Blue zones are 5 areas in the world where we consistently produce many, many high levels of centurions, people that live to be 100 years old. Why is that? What is about these blue zones? We're going to talk about that more as this seminar goes on, because we want to understand that people that live in these blue zones also endure their COVID infections better than people with chronic disease. So that's one of the things we'll be exploring this week. So my research shows that plant-based diets cause longer life, less disease. I have research showing 8 factors that lead to healthy longevity: nutrition, exercise, water, sunlight, temperance, air, rest, and trust in God. If we make an acronym out of that, NEWSTART is New Start. That's our program, the New Start program. We use these 8 natural doctors to teach people how to live longer, healthier lives. And in so doing, we boost your immune system and give you a much better chance against surviving a COVID infection. So I like to look at our garden pharmacy. There are reasons why food can be our medicine. Hippocrates actually said, "Let our medicine be our food." Phytonutrients are really one of the chief immune boosters that we can get out of plant-based diet. So in vegetables, fruits, seeds, nuts, lots of phytonutrients, and they concentrate themselves in different organs in our body. So different foods that we eat, different colors that we eat, go to different places in our body and boost our immunity in those places in our body. For example, allicin, quercetin, they'll concentrate in the blood vessels. They affect white blood cells, promoting a healthier immune system. Lutein, zeaxanthin, found in spinach, corn, other yellow, green leafy vegetables are concentrated in the retina and the lens. This can translate into reduced cataract and macular degeneration. And already you kind of intuitively know that because your eye doctor, in people that you know that have macular degeneration, what are they prescribing for them? Lutein, yeah, for the eyes. And so we can just get it in our food. We don't have to spend $1 billion on supplements to treat these things. We can just eat what we need and get exactly what we need to take care of us. Now, I was explaining this to somebody earlier, and I'm going to illustrate it for you here, but I was talking to a patient today about the color code and eating a rainbow. Have you ever heard that said? You should eat a rainbow. So when you look at your plate, you want to see as many different colors as you can. So the color code, the carotenoids are chemical compounds that absorb visible light and so determine that carrots are orange, tomatoes are red, marigolds are yellow. There are approximately 700, and I believe that's much higher now. That's over 800 different known carotenoids that have been isolated from plants and animals, and they are absorbed into the bloodstream and end up in the tissues where they protect against DNA damage and enhance our health through the immune system. So this is one of the principal ways that we can avoid cancer and things that are infectious, because our immune system gets boosted. It helps us in the transition, the initiation of cancer process. It helps abort that. So it's much harder for a vegetarian to get cancer than it is for a carnivore. There's actually a gigantic study that's been done not too long ago called the China study. Anybody ever heard of that? The China study, written and authored by T. Colin Campbell, one of the world's foremost leading researchers in protein research. And his whole idea when he went into study, he grew up on a dairy farm, and it was his goal to help his parents develop their dairy farm so that they could get the most protein per animal, so the most milk they can get. And so that was his goal when he started. What he found on that road in trying to develop this great dairy farm and enhancing his parents' income and livelihood was that along the way, this protein in milk caused cancer. And so he got very involved in trying to figure out how that happened, why that happened. And the government of China, actually some time ago, was noticed. China's a very polluted place. Have you ever been to China? Been there about 4 times. A very polluted place. And what the government noticed is that there are pockets of places where there's a lot of cancer, but everybody's exposed to the same level of pollution. How come these people are getting cancer and these aren't? And what he discovered through his research, and which is turned out to be the book, The China Study, and if you haven't read it, you certainly should. What he found out was that people that ate like Americans got the cancer. People that ate like the Chinese peasants of old did were protected. So they were mostly plant-based. And so the plant-based people were not getting the cancer that the Western diets were. So these things are absorbed into our body, they protect our DNA, they boost our immunity. So this is called the color wheel of foods, and we have 2, 4, 6, 7 different categories here of different colors that you'll find in your foods. And I'll spend one night, we'll go through this in a lot more detail, but just so that you're aware, try to eat one of these colors every day, and try to put as many on your plate at every meal that you can do. So there's the reds, the red purples, the orange yellow, the yellow green, the greens, the whites, and the white greens. So different colors have different phytonutrients, collect themselves and concentrate themselves in different places in our body, enhancing our immune system and different body systems. Does that make sense? Yes. This is becoming more and more mainstream, as a matter of fact. This book, it's a booklet taken from, wasn't taken, it was given. But I take the picture from Kaiser Permanente. They have a pamphlet called The Plant-Based Diet, A Healthier Way to Eat. This is well known by health professionals now. Many, many, many doctors are signing on to this, especially cardiologists. Cardiologists are seeing a great benefit from plant-based diet because it slows down the progression of atherosclerosis, which is clogging of the arteries that leads to heart attack and stroke. So it is really the most healthy way to eat. It's being more widely advocated. Strict vegetarian diet with no animal products. And there's a religion, Seventh-day Adventists believe this is how God instructs his people to eat. And they follow that. They believe that. They follow that. And they have one of the blue zones in the world. We were talking about that earlier. Happens to be Loma Linda, California, where I did my medical school training. And that's where my professor at 105 was out mowing his lawn, because he lives in a blue zone. That's how he lives. He uses the 8 natural doctors. He's a vegetarian, or was. He's gone now. And we have found out that Seventh-day Adventists live the longest of all. So you want to live like a Seventh-day Adventist if you want to have a long and healthy life. That's how you want to do it. So we're going to investigate how Seventh-day Adventists live and eat during this week. So eat like a Seventh-day Adventist. So how is that? How do they eat, and what do they do? Well, they have some Bible texts that they have taught me and I have learned from. In Genesis 1:29 it says, the original human diet. And God said, behold, I have given you every herb-bearing seed which is upon the face of the earth and upon the trees, and in which the fruit of the tree yielding seed, to you it shall be for food, or meat. So that's your meat. And so they have found out that by following these principles, people live long, healthy, productive lives. And that's what they do. National Geographic recognized the blue groups, and they did a focus on a few of them, found in National Geographic November 2005, The Secrets of Long Life. And so in The Secrets of Long Life, they found out these 5 different people groups, I don't remember all of them off the top of my head, but I'll try to give you at least a few of them. Okinawan, Seventh-day Adventist, Sicilian, those are 3 of the main that we're focused on. I don't remember the other 2. We'll see it later in one of the lectures. But what they had in common were some very basic principles of life and living. They all ate plant-based diets. They all had focus on the importance of family. They were spiritual people, and they were active people. And so we find that here's 4 of the 8 natural doctors that we teach in our program, that people in other societies and other parts of the world figured out all on their own, and they follow those, and they have a great number of centurions they produce in their societies. And so, again, Adventists live the longest of all of them because they have 8 natural doctors. The rest have 4 or 5 that they figured out. But when they looked at this, they broke it down. They interviewed the families and the people involved, and these are the factors they found that they had in common to live a long life. So when I became interested in this, somebody showed me this graph, and this had such an impact on me. If we look at this study, this was done way back in the 1970s, 1977, published in Lancet. What we find here is they took people that had high cholesterol, predisposed to heart disease, and they put them on strict diets, 2 groups. One was an animal protein diet, the other was a vegetable protein diet. They went 3 weeks on those diets, and what they showed was what you see. Now, this animal protein diet was a lot healthier than the standard American diet. We'll talk more about that later. So they got a nice drop in cholesterol, about 30 points, which is what most people do when the doctor tells them you need to drop your cholesterol and I don't want to take medicine. So they go home, they eat a lot of oatmeal, and they put some plants in their diet, and we see about a 30-point drop. But the people that were put mainly on a vegetable protein, and they were using soy protein in this study, they dropped about 70 points in 3 weeks. I can't even give you a medicine, a statin that works that well. They just don't. So they thought, well, maybe these people have a genetic predisposition to having that advantage. So they switched the diets here after 3 weeks. So the vegetable were put on the animal protein put on the vegetable protein. They went another 3 weeks, and guess what? 110-point improvement on the improved diet. And I have seen this in my practice. I don't know how many people I have started on this program that I've seen this 100, 110, 120-point drop very consistently. In fact, I had one time a patient came in and she was already a vegan. And she was very worried that she wasn't getting enough protein. And so we had a little discussion. She said, I'm going to introduce some animal protein. I said, okay, well, let's try it, see what happens. I had her back in a couple of months, rechecked her cholesterol. Her cholesterol went up 110 points. And she was still eating mostly plant-based. She just introduced some meat into her diet. She immediately, after she saw that, took the meat out of her diet, decided it wasn't worth it, dropped 110 points back to where she was before. As far as I know, she's still on that vegan diet. So even Kaiser Permanente recognizes, showed you the pamphlet from before, but helping patients adopt healthier lifestyles. Healthy eating may be the best achieved with a plant-based diet, which we define as a regimen that encourages whole plant foods, discourages meat, dairy products, and eggs. So, you know, even one of the largest healthcare providers in California is on board and understands these principles. So, study taken from the British Medical Journal in 2014 showed vegan diets significantly lower LDL. Trials of vegan and vegetarian diets also reduce progression of coronary artery disease. Sorry, it's a long day today. Plant food components such as vegetable proteins, vegetable oils, nuts, and viscous fibers reduce serum lipids in many studies and may increase flow-mediated vasodilation. Nuts, fiber, vegetarian diets in general reduce coronary heart disease, diabetes in cohort studies. And it just goes on. And this was all published, so we know this. As a medical community, we know this. But still not everybody is on board. It's happening, it's coming. Dr. Clive McKay, PhD, Department of Nutrition, actually was the head of the Department of Nutrition at Cornell. He noticed something about Seventh-day Adventists and did a lot of research on it. And after reading the books that they have, he said this: in spite of the fact that the writings of Mrs. White were written long before the advent of modern scientific nutrition, no better overall guide is available today. And so he learned, he's not a Seventh-day Adventist, but he learned from them how they live and why he wrote this. He looked through all their literature, studied what Mrs. White had written on the topic of health, and decided, this is how I'm going to make my program. So he modeled his program after hers. And he agrees with Nathan Pritikin, who wrote this in 1979. I think that if you want to get to the originator of the proper diet, you have to go back to Ellen White. She laid guidelines that unfortunately are not being adhered to as strictly as they should be. Now, this woman has had a great influence on the Seventh-day Adventist Church, and through what she has written, the adherents of the Seventh-day Adventists that follow this are living very healthy, long lives and have great immune systems. So when we look at some of the things, and I'm not going to focus on things that she wrote, but there's a couple things that are worth looking at. And because she wrote this stuff way back in the 1800s, way before the advent of modern medicine, and had a very keen insight into illnesses and disease. So when sickness comes, it is essential that we employ the varied agencies which, in cooperation with nature's efforts, will build up the body and restore the health. So she understood that just using natural methods, you could restore the health of an individual. There is also a larger and more vitally important question, that of our relationship to the Creator who originally gave man his life, who made every provision for his continued happiness, and who today is interested in his welfare. Our Creator has furnished us in vegetables, grains, fruits, and elements of nutrition necessary for health and strength. So that's how she looked at it, and that's what she wrote about, and that's what her followers have done. Now, we take a step back and we start looking at the standard American diet as compared to how Seventh-day Adventists live and eat, we see some remarkable trends. The comparison contrast is unreal. If you go back to 1990, which is the upper United States over here, we're looking at obesity trends. So this is the trends of how obesity really developed in the United States between 1990 and 2006. And what we see is the blues, the whites, there's less than 10%, 14%, 15 to 19%, 20 to 24%, over 30%, 25 to 29%, and over 30%. So you can see just 8 years. Now the average in the United States is between 15 and 19%. By 2006, just 8 more years, you can see a great deal of the United States is running in the 25 to 30%. Right now, the obesity rate in the United States is running close to 40%. 40%. And this is important for us to understand because remember, we want to know how to boost our immune system and how to avoid chronic disease. When we look at this is a 2010 trend, so that's still 12 years old. We find out as we look at the studies that lifestyle disease increases death risk, overall cause. So the more obesity we see, the more smoking we see, the more sedentary lifestyle we see that the rates of disease go up with these. And so we want to learn how to undo this. So we look at hypertension, we look at COPD, we look at diabetes, we look at smoking, we look at BMI, the overall weight, the body mass, thank you, the body mass index, and our total cholesterol. We see that, and we look at what kind of exercise tolerance people have. And comparing that, we see our relative risks of death from those two numbers. So as we look at the numbers by labs and their ability to exercise, we can predict what your relative risk of death is. So this is where New Start comes in. Nutrition, exercise, water, sunlight, temperance, air, rest, and trust in God. I've mentioned these already, and like I said, we'll spend a lot more time investigating these as the week goes on, but I want you to become familiar with them. So this is our program. We focus on nutrition, we focus on exercise, we focus on water, we focus on sunlight, temperance, air, rest, and we focus and trust in God because we have found that these 8 natural doctors promote healthy lifestyles, longer lives, boosted immune systems, and not just longer lives, but longer, healthier, happier lives, which is what we all want. So I'm going to remind you of something that I read in my Bible one day that I was really impressed with. It says, "Beloved, I wish above all things that you may prosper and be in health, even as your soul prospers." When I first went into private practice, I put that on my business cards. That's how I feel for you. I am here to try to help you. I wish that you were all very healthy, had the optimized immune systems, and that you had no hypertension, no obesity, no diabetes, no heart disease, no strokes. I don't want to see that in any of you here. That's my passion as a physician. So if there's a way that I can make that happen, I will help you to that end. So we're going to spend the rest of the week looking into great detail about how to improve our health through these 8 natural doctors. So Jesus, one of the greatest teachers that ever walked the face of the earth, spent most of his time doing what? Healing. He healed people. And I feel like that's what I've been called to do. I wish I could heal like he did, but I have information that can help you so that you can be healed. Matthew chapter 10, verses 7 and 8 talks about healing as you go preach, saying, the kingdom of heaven is at hand. Heal the sick, cleanse the lepers, raise the dead, cast out devils. Freely you have received, freely give. And that's how I feel. I feel like I've been blessed with information that I would love to be able to share with you so that you can live a happier, healthier life. And finally, in Luke chapter 10, verse 9, it says, heal the sick that are therein, and say unto them, the kingdom of God is nigh unto you. And so God desires for us to be healthy and happy. He did not intend for there to be disease and suffering and sickness in this world. That was introduced through other means. And so he has given us information to help us live a way that he intended us to live so that we can live longer, healthier, and happier lives. So with that, we're going to end this evening. We'll spend, like I said, a great deal of time looking at how to boost your immune system and avoid these chronic diseases. Are there any questions tonight? Yes?
So, I recently had 2 cataract surgeries, and the second one didn't work. So, those particular vegetables and stuff, if I concentrate on that, would that just make the retina stronger, or what does it do?
So what we're talking about, and we'll talk about this more tomorrow night, is the difference between preventative and reversing. And so always the ideal is trying to prevent. But we can do a great deal to reverse. And so as we do our best and follow these principles, we see everybody get better. Will it ever be 100%?
No.
Probably not. But can we be better? Yes, we can. And I tell you, I've done this program with about 300 patients, and every single one of them gets better. Are they all cured? No, but a lot of them are. A lot of them are. But we always make them better. Not me, the program. I believe these principles make everybody better. Any other questions? Please.
Can I make a comment?
Sure, please.
I've been doing this vegan for 6 years now.
Yes, sir.
My diet was really obnoxious. And since I went on the diet, I lost 100 pounds. And all my type 2 diabetes is basically gone, which was, my type 2 diabetes was through the roof.
Yep.
So then my doctor told me that, you know, you're a little short on protein. Check my blood. So just for the fun of it, I saw a little can of tuna. I never touched any flesh food for 6 years. I looked carefully in my food, but there's no cheese, and it just, it helped me so much that I was not going to go back. It's a matter of, do you want to feel better, or do you want to eat what you're used to?
Yes.
And my younger brother said when he went to Weimar, he said, if it tastes good, spit it out.
Well, I don't know. My wife cooks pretty good vegan food, so.
But I tried that little can of tuna, and my blood pressure before that was down to 100 over 60. And after that one can, it went up to 150 believe there's a God that watches every little thing we do. And after I ate that can, and I said I'm sorry, guess what? I went back down to 100 to over 60.
How about that?
So
Yeah.
anyway, God is my helper, and getting to knowing what to do is a big deal.
Yeah, yeah.
So I really appreciate this program.
No worries. I'm gonna introduce you to many patients this week that you're gonna get an opportunity to learn their history, what happened, and how their lives changed because of what Dr. Norman was just telling us about. So this is not a one and done thing. I have seen dozens and dozens and dozens, hundreds of people have their lives changed by adopting the 8 natural doctors into their lifestyle. So it's very doable, it's very real. It does take a level of commitment to commit to this because it's very different. There's an education process that goes along with doing this. If you walk out of here tonight and decide I'm going to eat salad and broccoli for the rest of my life, that's not going to last very long. You're going to get very tired of it. So we're going to have a cooking class later in the week to teach you how to make delicious foods that are healthy and nutritious and will boost your immunity. Any other questions this evening, please?
I'm not running out of it, but I can't see after it gets dark.
Yeah, no, I get it. Be safe.
Or I'll see you tomorrow.
Yeah, very good. Thank you.
Bye.
Yes.
You said you have a practice. Where's your office or?
Yes, I practice with out on Lakeview with Kaiser Permanente. I'm a Kaiser physician. So, yeah, I'm in the adult and family medicine department. Yes. Yes.
I was eating Impossible Burgers and Beyond Burgers and was loving it because they tasted great and it gave me lots of energy. Until I found out the way that they are made is by having some cells from the animal put into it and then manufactured into that. I was so disgusted I quit eating them. That was like about almost 2 weeks ago. But
Well-
I'm having trouble getting enough energy from other foods.
Yeah. So I've heard that story about those before, but my understanding is, as I've read about the research behind them, is that what they did was copy the animal protein that's the hemoglobin. And that's what's in there. It's not from an animal. It's, I hate to say natural, it's probably chemicals. Are these great for us? No. What do I teach in this program? So when we talk about nutrition, we're going to look at this more this week. We're going to spend a lot of time on it. I teach whole plant foods eaten whole. Is that Impossible Burgers? No, that's not what we teach here. It is vegan, but there's an awful lot of fat in these prepared foods. And so, you know, they're probably a cut better than the actual animal product. But for a health standpoint, I wouldn't necessarily consider them a health food, okay? And so whole plant foods eaten whole. And we're going to talk more. You'll hear that over and over and over again this week. So, yeah, for sure. Good point, though. Yes. Anybody else? Other questions, comments? Yes.
Thanks to Norman who came to my church last Sunday. I'm here. Is this free or do we contribute something to pay for this space?
No, it's free. So just come and enjoy. We want you to enjoy it.
Thank you.
Yeah. So don't worry about that. If at the end you still love it and you want to donate something, I'm sure Ernie or Pastor Dan can help you with that. So any other comments, questions? So I do this. This is a burden of love for me. I don't get a cent for doing this. What I get is satisfaction knowing that I'm helping people, and that's why I'm here. That's what I like to do. And if anybody has questions or if you need a few minutes of my time at the end, I am happy to step aside with you and discuss an issue that you might have. So, yes.
If you know somebody that tried to log into Zoom tonight and couldn't get in because they didn't have the new link that Zoom suddenly assigned to our meeting, I will send out the new link to everyone, and if
Yeah, yeah.
you want to, you know, you could send an email to me, and I'll send you the new link, or send them the new link, whatever.
Okay. I wasn't paying that close attention, but I think Chris might have. Were there any questions on the Zoom, by the way?
Not on the one that I know.
Okay, very good. All right, well, we'll try to get everybody updated on Zoom. Maybe we can just send it out again through emails and so forth. So I'm sorry that happened, but that's how it goes sometimes.
Thank you so much,
Anyway,
Dr. Snyder.
you're more than welcome. Thank you.
Wonderful. We hope to see you here tomorrow evening, same time. Come a little early to try the samples and engage and discuss questions. When you fill out this survey, don't just think about yourself. What, do I have an interest in this? Maybe, maybe not. But think about your friends, someone that you know that could benefit from this, and check it. Yeah, this is for so-and-so, and then invite them. That friend may, or family member may have a desire to come to our next seminar. So when you fill out the survey, think of someone that you know that might benefit from these. We have a beautiful gift bag that Vanessa has prepared for your shopping with a pen, and the bag is not empty. It doesn't have $1 million in it, but it has the gift of health, wow, which is more than $1 million, and a notepad that you can write down your questions so that at the end you can remember your questions. So please take a wonderful gift shopping bag and your survey. Please turn them in to Vanessa and she will collect them. Thank you so much for coming, and we hope to see you here tomorrow evening. Remember, our last evening is Thursday. The date on the 27th on the flyer is not correct. You don't go till Friday. You just go Monday, Tuesday, Wednesday, and Thursday.
Yeah.
All right? Have
All
a
right.
good evening.
Have a good evening, everybody.
See you tomorrow night.